Service-Learning, a way for students in Ngee Ann Poly to learn by connecting with and serving communities around them. But in the face of COVID-19's new normal of masks, social distancing, and Zoom meetings, how could this pedagogy, so reliant on community engagement, work? Well, we got creative and together with partners, designed projects that could be carried out remotely. Projects such as conducting online workshops and surveys, or developing design proposals, websites, and social media campaigns, to name a few. Today, we'll meet staff and students from Ngee Ann Poly and take a look at how service learning has pivoted to eService-Learning.
As face-to-face interaction was limited, there was less scope, flexibility, and diversity. We had to seek out community partners who were willing to co-curate projects that could be done remotely or online.
But this actually gave us the skills to adapt, innovate, and still serve the community.
Our BA students produced micro-lesson videos on personal budgeting, which were used to coach migrant domestic workers via WhatsApp. At the same time, students were pushed out of their comfort zones. They had to overcome communication barriers, apply active listening, and provide clearer explanations.
We could not physically meet with partners, local and overseas, due to lockdowns and travel restrictions. But this opened up new modes of collaboration as we made the most of online platforms to explore, discuss, and gather feedback so that our students could propose suitable designs for the community facilities in Cambodia and Indonesia.
It was great that we could still serve communities overseas. It exposed us to working with different climatic conditions and materials that we might not normally use in Singapore.
COVID-19 might have closed some doors, but it opened others. It gave us a chance to explore new projects like the one with Dialogue in the Dark Singapore.
We developed health education materials for the blind. This gave us insights into how to better communicate with blind patients as future pharmacists.
We are grateful to our community partner who took care of arranging laptops and tablets to be sent to seniors who needed them. Therefore, my students could focus on how best to teach the senior digital skill.
Teaching the seniors remotely was not easy. They had a lot of questions and concerns. We had to go slow and explain step by step, which taught us to be patient.
We did an online survey about migrant workers, so it was good that my lecturer did a strong debrief. He asked us questions that made us think more deeply and drew out key learning points.
With COVID, it was really hard to incorporate interaction with ex-drug offenders, but it was important to do so for my students to better understand their journeys and the issues at hand, and thus develop a more impactful anti-drug abuse social media campaign.
My student could not connect directly with the residents, so it helped that a staff from the home did a good job sharing online. She really motivated the students. I was amazed at the good mix of multimedia resources they came up with for the residents to learn about Chinese folklore and the arts.
Yes, the world changed and we were thrown off balance. There were challenges finding suitable projects and partners. Some projects simply could not be pivoted online. And we missed interacting in person with the communities we served. But we adapted where we could to do our best to engage, perhaps not face to face, but hopefully heart to heart.